Good afternoon, everyone. My name is Robert Fields, and I'm here to discuss my opposition to House Bill 177, also known as the Better Access, Better Care Act. For those not familiar with the Act, it looks to allow nurse practitioners to practice independently by the following. It allows an advanced practice registered nurse who is certified nurse practitioner, clinical nurse specialist, or certified nurse midwife to practice without a collaborating physician or podiatrist. Eliminates the requirements that the APRN enters into a standard care arrangement with one or more collaborating physicians or podiatrists and practice in accordance with the agreement. Makes conforming changes to the laws governing APRNs and other healthcare professionals. Prohibits a physician from issuing a Schedule II controlled substance prescription from a convenience care clinic. Allows a school district or youth sports organization to authorize any licensed healthcare professional to assess an athlete for a concussion and to clear the athlete to play. During its entire existence, the nurse practitioner role has been ever-changing. Cooper, McDowell, and Rayside define the NP as a registered nurse who has acquired an expert knowledge base, complex decision-making skills, and clinical competencies for expanded practice, the characteristics of which are shaped by the context and or country in which he or she is credentialed to practice. A master's degree is recommended for the entry level. This was in 2019. Along with decision-making skills and expanded knowledge, they usually collaborate with a physician and work under direct supervision of one or more as well. One of the biggest challenges they face in the role is how much it varies state to state. In most states, the Board of Nursing will determine their scope of practice, and those will also vary based on what type of nurse practitioner, acute or family, for example, they are practicing in. These are different in each state as well. Lastly, nurse practitioners have a variety of skills they can perform, but it has not always been this way. When coming into existence in the mid-1960s, they were under the supervision of a physician and mainly rounded and collaborated to review what they thought their course of treatment should be for a patient, and the physician had to approve of that plan of care. That was Hudspeth and Klein in 2019. Now, in most settings, NPs can essentially act as a physician by prescribing medications, placing lines in critically ill patients, seeing patients for follow-up appointments, managing diseases over a lifespan, and so much more, virtually on their own, but this also varies state to state. Although NPs have a unique skill set and are highly educated and qualified to possibly practice independently, for better patient outcomes, I feel that it is safer to continue to work alongside physicians. According to Schroeder 2019 of the Dayton Daily News, physician groups say these supervision agreements aren't just red tape, but are necessary rules to protect patient safety since NPs have less education than physicians. This is not to say that physicians are better than nurse practitioners. However, physicians do feel it is important that NPs go through less training than a physician. Physicians also go on to say that NPs do have a unique skill set and that the most effective way to maximize better patient outcomes is to collaborate and continue to work alongside one another. That was also Schroeder 2019 of the Dayton Daily News. Along with urging NPs to continue to work alongside physician, the National Organization of Nurse Practitioner Faculties also states that NP core competencies are acquired through patient care experiences with an emphasis on independent and interprofessional practice. That was in 2012. I feel this can be interpreted in multiple ways. However, it seems to me that they are encouraging NPs to think independently, yet also collaborate with physicians as well. In another study done by Krause and DuBois, data indicated that NPs can do 90% of what physicians do in the primary care setting with comparable outcomes. That was in 2017. However, what about the other 10%? This is important because yes, they can do most of what physicians do, but not everything. One of the NPs that was interviewed in this study went on to say that collaborative practice agreement is important with physician groups because NPs don't have the same education as doctors. And although he is confident in his abilities to make a diagnosis and treat the patient, the supervision of a physician is important. That was Krause and DuBois 2017 as well. Another important part of the same study by Krause and Du Bois is that when interviewed, doctors and NPs reported having a great working relationship and liked being able to collaborate with one another. Being a nurse that works in a neuro ICU at Mount Carmel East, I see NPs from neurosurgery and trauma around on patients all day. They develop their plan of care, make decisions for their patient, even go as far as making the decisions whether to place lines, what kind of medications they'll be on, what kind of tests they'll go to, and they work very well with attendees that they serve under. I feel this working relationship is extremely important for both NPs and physicians. Why use one brain when you can use many to help achieve the best care outcomes for your patients? Thank you for your time.